Hello, Pharma aspirants. Welcome to Pharma Syndrome YouTube channel. In this session, I am discussing anti-cancer drugs part 2. So regarding part 1, already the video in our channel. So you can visit there and you can enjoy with mnemonics as well as tricks. And subscribe to our channel, Pharma Syndrome YouTube channel. And like, comment, share your views on our channel. And let's going into the session. So in the part 1 anti-cancer drugs classification, I discussed regarding alkylating agents, regarding antimetabolites, regarding tyrosine kinase inhibitors, and some of the drugs. And now, regarding anti-cancer drugs part 2, I'm mainly focusing on the hormones used as a drugs in the treatment of cancer, because some of the hormonal derivatives and hormonal antagonists used in the treatment of different types of cancers, and definitely you will enjoy and you will learn easily with tricks. And even the same classification, mostly you will come across the endocrine system pharmacology also. And let's see hormones used as a anti-cancer drugs. Hormones used as a anti-cancer drugs. And hormones used as a anti-cancer drugs, the mnemonic is the PAGE, P-A-G-E. In that page, first one is the progestins. So progesterone preparations are generally used in the metastatic cancers. Metastatic cancers. And that is simply regarding progestins, especially metastatic endometrial cancer. And next one, anti-androgens. So anti-androgens, nothing but they shows opposite action to the testosterone. They acts by blocking the androgen receptors, nothing but also called as testosterone receptor. The anti-androgens like mnemonic, fenba, and they are like tamides, like flutamide, like enzalutamide, like nilutamide, bicalutamide, as well as apalutamide. All these are anti-androgens, blocks testosterone receptor, nothing but androgen receptors. And next one, GnRH analogs. For example, anti-androgens generally used in the prostate cancer. Prostate cancer. And GnRH, gonadotropin releasing hormone drugs. In that, drugs acts as a agonist at GnRH receptors with the mnemonic bus trip goes New York to London. So bus, buserelin, trip, triptorelin, goes, gosirelin, N, nafarelin, L, leuprolide. All these are agonist at the GnRH receptor, gonadotropin releasing hormone receptor. The use of this GnRH agonist, is prostate cancer as well as breast cancer in the postmenopausal women, and also used in polycystic ovary disease as well as endometriosis. So endometriosis, nothing but here excess proliferation of the endometrial cells may develop the cancer, endometrial cancer. Next, antagonist of the gonadotropin releasing hormone, like the mnemonic or trick is God say rude. Nothing but God say, nothing but who killed the Gandhi. So God say rude. G means ganirelix, A means abarelix, D means degarelix, C means cetrorelix, E means elagorelix or elagolix, and religolix. All these are examples of GnRH antagonist. And this GnRH antagonist used in prostate cancer in the males, and in the females reduces ovary hyperstimulation. And next, glucocorticoids. So glucocorticoids like prednisone used in the treatment of cancer, especially they decrease the inflammation. They decrease inflammation because glucocorticoids are having excellent anti-inflammatory properties. And next is the estrogen drugs. In this agonist, the agonist example is phosphestrol. It is a prodrug of estrogen used in the treatment of prostate cancer. And next, antagonist. In the antagonist, two categories are there. SERA, SERA, selective estrogen receptor antagonist, or selective estrogen receptor degraders like fulvestrant as well as clomiphene citrate. And next is the SCRM, selective estrogen receptor modulator. So they can modulate the function of estrogen receptor and with the trick TOR, like tamoxifen or meloxifene as well as relaxifene. And next, aromatase inhibitor. So what is the enzyme aromatase? Aromatase is the enzyme conversion of testosterone to estrogen by the process of aromatase enzyme. So aromatase involves in aromatization of testosterone to estrogen. Especially this will be happening in the males. If the amount of testosterone present in the males converts to estrogen, that estrogen causes abnormal increase in the breast of the male. Nothing but abnormal increase in the breast tissue of the male, that is gynecomastia, especially the aromatase inhibitors used in the male breast cancer. Simply like gynecomastia. And here, 3 generations of aromatase inhibitors. In that first generation with mnemonic fat, that is F means first, A means aminoglutamide, which is a reversible steroidal aromatase inhibitor. And T, testolactone is a non-steroidal irreversible aromatase inhibitor. Next, second generation. Second generation SFBF. S means second, F means fadrozole, V means orozole, again F means formastane. So here you have to remember reversible steroidal. So they having steroidal structure, steroidal nucleus. And non-steroidal irreversible category, they are not having the steroidal structure. Next, third generation with mnemonic tail. T means third, A means anastrozole, L means letrozole, E means X-mestane. E means X-mestane. So that is simply aromatase inhibitor. So apart from this total classification, there is the immunomodulators which can stimulate, which can support activity of immune system in the cancer patient. As you know, in the cancer patient, the immune system is weak. The drugs like levamisole, thalidomide, lenalidomide are having good supporting immune system property. They can support the immune system. They provide the immune strength to the patient, cancer patient. And one of the miscellaneous category drugs like L-asparginase, a enzyme preparation for cancer treatment derived from the source of E. coli, Escherichia coli. And one of the another drug is hydroxyurea, specifically for treatment of sickle cell anemia. So hydroxyurea, nothing but hydroxylation of urea gives hydroxyurea. So this is about anti-cancer drugs classification part 2. So part 1 is already discussed and I posted in our channel. So subscribe to our channel, like, comment, share regarding our channel. Thank you. All the best.